CHH News asked Ontario's top doctors about the rising ICU numbers during this afternoon's press briefing. Dale Manukduk joins us live with more. Dale?
The reason Ontario health officials are so concerned about that ICU number is because it is dangerously close to that 150 number that you mentioned earlier. And once we pass that 150 number, it is going to be harder for hospitals to provide care unrelated to COVID-19. The 146 patients in intensive care represents a 49% increase from the previous week.
If it goes over 150 for COVID, then it will impact negatively on people requiring ICU care for other reasons.
CHCH News producer Randy Rath asked Dr. Barbara Yaffe and Dr. Dirk Heyer what those impacts will be.
Those particularly with elective procedures, surgeries, or cardiac procedures that are going to have to wait longer.
Dr. Heyer says staffing ICUs will be a challenge if the number rises above 150.
The number is based upon the number of available beds and staffing, importantly, because it's a highly technical and a highly complex care area within the healthcare system.
According to Yaffe, the number of available beds increased from the first COVID-19 wave to the second. Dr. Heyer explained why fewer ICU beds were needed earlier in the pandemic.
During stage one was car crashes reduced, so there was less chance of people being injured and requiring intensive care unit. Surgeries were not occurring, and so there wasn't the need for after the surgery for the people to have that intensive care.
Yaffe believes the increase in hospitalizations and ICU patients is because the virus took longer to reach vulnerable people during the second wave.
It started this time in the second wave with young people, 20 to 39 age group. It's now hitting the older people, it's getting into long-term care, retirement homes, and so on. And we know that people, particularly over the age of 60 or 65, are at higher risk of serious illness and, unfortunately, complications and death.
7 of Ontario's 26 new outbreaks reported today were in long-term care or retirement home settings. Now, we also pressed both doctors about schools remaining open while community transmission is high. The current 7-day average for Ontario is 1,369 cases per day. Dr. Yaffe says that keeping schools open remains a top priority for Ontario and that the schools are doing a great job keeping outbreaks to a minimum. Back to you.